residents of Freedom Village. This is John Bruner, your Executive Director, and welcome to our December Village meeting. Unfortunately, we couldn't be in person with you, so we're doing this meeting virtually, recorded on the TV, played on Channel 1970, and I really do look forward to being in person with you in the very, very near future for our future Village meetings. So we have a great agenda today and a lot of great speakers, and I want to tell you that our first speaker is Dr. Andrew Ulichny, our medical director. I sat down with him and spoke with him about the current state of COVID and what's going on in the hospitals and what his recommendations are for us as a great contributor to our task force and supporting us here at Freedom Village as we navigate this pandemic. Following my interview with Dr. Ulichny, I'm going to give you an update on things going on around the community, things to be watching out for to protect ourselves during this pandemic. Then Karen is going to give you an update. Karen Hills, our executive assistant, will give you an update on community lighting that she's going to be able to share with you. Rick Tavani, our maintenance director, will be able to give you an update on maintenance happenings around the community. Followed by Sarah Sherman. Sarah will give you an update on what activities we're still doing, even with the restrictions that we do have. Some activities and exercise classes and meetings are still occurring. Jeremy Turpin, our dining services director, will be here to talk with you about the holiday party on December 18th. Followed by Laura Miller. Laura Miller is our wellness nurse. She'll have some tips for you on staying safe during the COVID pandemic. And last but not least, Ross Small, our Human Resources Director, will talk about the Employee of the Month here at Freedom Village, as well as employee anniversaries, as well as employee birthdays. Well, joining us today for our Village meeting presentation is Dr. Andrew Ulichny, our Medical Director. Dr. Ulichny, thank you for joining us.
Thanks for having me again.
I really, as I've said many times, we truly appreciate your leadership and your guidance as we've made it through this pandemic as far as we have. And we're really at a critical point in the pandemic, which is why I invited you here today to just give us an update on what's going on in our area with the infections and what our residents here at Freedom Village should be aware of.
Okay, John, thank you for having me. Thank you everyone again. We are in the critical point of 2020. The end of the year is showing us numbers like we did not anticipate a few months ago. So we as a group at Freedom Village talked about the pluses and minuses of having a format such as this, where we all could answer some of the questions without getting together for our typical meetings, and bringing a group together of 25 people just seems like it would be considered a super spreader event, and I highly discourage it. With a county prevalence over 10% right now, the risk is too high when we could get this information out. I'll tell you, as of today, the number of patients at all mainline hospitals is over 200. It has been a steady increase since the middle of November. Our internal analytics, because of the numbers that we're seeing, and when a patient with COVID comes into the hospital, our typical playbook for a hospitalized patient gets thrown out. Usually when we have a patient come to the hospital, the average length of stay is 4 to 5 days. With a patient with COVID, there is no typical COVID, but the average length of stay, if you have that diagnosis, is over 10 days. So what happens is any admission just keeps accumulating, and that's what we're experiencing. Mainline Health has had to cancel over 140 procedures this week, which is bad for the patients who were expecting the procedure. It's also bad for the health systems across the area, because that is where they do make their money. So when you fill a bed with a patient that does not have the typical in and out that the hospital's used to, it becomes a cost to them. based on the way that the mechanics of medical payments. So the long and the short of it is we are expecting this wave to continue, and now our internal analytics anticipate that we're going to exceed traditional areas where we take care of patients in the hospital. What does that mean? We're going to have to tap into spaces that we typically don't keep people, or if we keep a patient there, we may need to use it as a long-term area where they are cared for, such as an endoscopy suite. Usually people come down to that unit, they're in and out. We may have to run it like a typical nursing unit and have 12 or 15 beds in that endoscopy suite. So that's what we talk about when we say non-traditional patient care areas. And we do have contingencies for putting up the tents and taking care of patients in parking lots, although that logistically offers a variety of challenges. And on top of that, John can speak to it locally, but we're running into a major workforce linchpin that can be the rate limiting factor of getting people out of the emergency room. We just don't have nurses to care for them on the floors. So that has been a challenge, because just like the prevalence goes up in the community, it goes up in our staff. So for your safety, keep doing all the hard things. We're wearing masks, one, because we're in the same room. Two, we want to remind you, and I apologize for anyone who has hearing impairment and traditionally would read lips, but right now what we're asking is to keep doing the hard stuff. Wear your mask, wash your hands, socially distance. Now, we're allowing visitation to continue, independent living, with the expectation that people are going to do all these things. And just like when John shut the door to this room, we didn't take off our masks because he doesn't know where I was, I don't know where he was. And while parents and children sometimes think, oh, we're in the same family, so we share everything. You share genes, but you don't share potentially infectious agents like COVID. And we're finding that it's very, very infectious, very easily transmitted. And our most recent wave of outbreaks in Freedom Village showed us that even just going to a restaurant where there were not a lot of people, the bacteria, or excuse me, the viral particles can hang in the air such that a space that is seemingly empty of people does have enough viral particle to get us sick if we're in the right place at the right time with the right risk factors. So again, please do what's hard. Especially during the holiday season, it is very hard not to be with family, not to be with friends, not to celebrate like we traditionally do, but that's our best defense against filling the hospitals even more, because 40% of people who get this infection do not have symptoms. They are primed to infect people because they're not showing typically what people expect when you're sick. And that goes on until it finds someone who will manifest symptoms. And if I have 10 people who get the infection, I'm expecting about one of them to end up in the hospital system.
So that's a really great point, Dr. Ulichny. And we talked about visitation, and I know you and I agreed that it was much better that we continue to have visitation here at Freedom Village than have all our residents go out to family gatherings, but very limited here. And in addition to family members or friends coming in to visit you at Freedom Village, we still do visit with each other. And you might want to go visit your neighbor to talk around the holidays, but just like Dr. Ulichny said, just because the door closes, just because you've been their neighbor for 10 years or longer, doesn't mean you let your guard down, doesn't mean you take off your mask where nobody can see you. You've got to do the right thing even when no one's looking. It's just so important. We could have many residents walking around, or staff, not knowing that we're carrying the virus, and we just have to protect each other from it.
Very true.
The other thing we talked about together and agreed is that the benefits of exercise and some of these smaller activities that we have. Did you want to talk about that a little bit?
Yeah,
Dr. Ulichny?
absolutely. One of the worst prognosis features of a patient who gets COVID is immobility. So we are encouraging people to continue exercising, continue to be mobile. Outside is outstanding, but because of this time of year, we do have to bring some of the offerings inside. We're going to do it in large spaces, or if you're in the health center, it's going to be limited numbers of people. Again, the gym I go to, I have to wear a mask from when I get out of my car to when I get back in my car. And I would encourage everyone to, if you're participating in a health-related activity, to keep your mask on. Clearly, if you're in the pool, that doesn't hold true. But everything else, I would say, absolutely should be continued to be masked.
Now, Dr. Ulichny, you and I talked before this presentation about vaccines, and I most recently, this past Friday, put out an announcement to all of our residents that Freedom Village, all the residents and staff have enrolled in a program called the Partnership for Long-Term Care Vaccination. And we were hopeful, and we understood initially that all of our residents here would be enrolled in that program and participate in receiving those vaccines over a 3-month period between the end of December and the end of February. Subsequent to putting that information out based on what we were told, we've been reading a lot, and I know Dr. Ulichny has heard a lot about potential challenges with being able to distribute as many vaccines as they like. My readings, as well as what I've heard from you, Dr. Ulichny, is that I'm hopeful, but there's a good probability that there won't be as many vaccines as they would really like in order to vaccinate all the long-term care facilities, all the senior housing communities like Freedom Village, as well as all the hospitals. And why don't you tell me what you're hearing, Dr. Ulichny?
Exactly what you said, John. One, the FDA hasn't given its final approval, so all of this is still under investigation. Number two, there's over 12 million Americans that meet the criteria of congregate living that qualify for the Step 1A designation, in addition to all of those caregivers in that area. And then when you talk about the frontline healthcare workers, like your ambulance drivers and ER staff, you're talking millions of people with a vaccine, that is extremely difficult to produce. This technology has never been implemented on a large scale. And in addition to it being hard to produce, you also have the limitations of distribution requiring very cold temperatures. We only have one freezer that can hold this at Lankenau, and we've already, as the health system, have said that any doses we get are going to be stored there, and we're going to bring our employees to the vaccine rather than the alternative. And again, I'm optimistic, I'm hopeful, but we also have to be realistic and realize that with 12 million other people at the same designation, this could take a while.
Well, I think those are two great points. Optimistic, hopeful, but being realistic, because there's a lot of logistical aspects to consider between, as we said today, as of now, I think the hearings at the FDA are still ongoing. All indications are that the FDA will approve it, but between approval and actually administering vaccines or rolling up your sleeves, there's a lot to be done, and quite frankly, a lot of news out there about not having as much as they would really want.
Correct. And just like any vaccine, to be effective, it doesn't matter what one person does or one community. You have to have buy-in of the entire community and population. So you're looking at the need to get 70% of the vaccination rates, or 70% of the population to be infected, for us to have any true hope of getting back to pre-COVID conditions.
There's going to be a lot that's going to happen in the coming months, and let's hope it all works in our favor.
Absolutely.
Are there any other thoughts that you would like to share with our residents as far as how to be safe in the coming months, best practices to follow?
It's the same: mask, social distance, wash your hands. Please do it like it's your job, like your life depends on it, or if not your life, your neighbors, your child's, your loved one, because we're at that point where I'm concerned about the capacity of our healthcare system to take care of the number of people that we're anticipating from the middle of November to the beginning of January who are going to experience an infection and end up in the healthcare system.
Well, that's a lot of great information for us. Thank you so much for joining us, Dr. Ulichny.
My pleasure. Be safe. Happy holidays.
Thank you. Well, that was a lot of great information that Dr. Ulichny had to share with us, and I would encourage you all to heed his warnings and really do think about how we're at a critical point in this pandemic, and that we do need to protect ourselves until the vaccine does come, which is the first topic on my community updates. On my December 8th memo that I put out to everyone, you probably read that and see that we are enrolled in a program with CVS to vaccinate the residents of Freedom Village and the staff. There's a bit of uncertainty still as far as what the supply of vaccines will be and when they'll come. We are waiting for a confirmation of dates, which we're told could be as soon as the end of December. Now that the FDA has approved emergency use authorization of the vaccine, the Pfizer vaccine, and long-term care facilities like ourselves are first in line with hospitals. So we're excited about that, but I'm still only cautiously optimistic to see that they'll have enough supply for all of us. So time will tell. As I receive the information, I will absolutely share it with you, but it's certainly promising news for us. But in the meantime, over the next several weeks, we do need to be prepared and safe. Next topic is the status of our therapy gym. The question's been coming up a lot. As many of you know, we did have to suspend operations in our therapy gym due to compliance with the way we're operating under Medicare. It was brought to our attention by individuals at LCS that we may not be operating in compliance with Medicare rules. So it was just something that came up with a review that LCS did subsequent to the beginning of management of our community under LCS. I continue to work with a consultant, a regional director of therapy within LCS as well, and we're looking at two solutions that we hope are pretty viable solutions to getting the therapy gym open soon. But I will share with you once I have more details about that. It's not finalized, but we're hopeful we do have some solutions that will be able to get the gym back up in operation for all of you. Next topic I want to share with you is the annual membership drive for Westwood Ambulance. You might have attended or watched a program about Tower Direct, a new ambulance service with Tower Health right next door at Brandywine Hospital. And we were leaning towards moving to make Tower Direct our primary ambulance and medic service. With the news that has come out recently with Tower's financial problems and potential sale, we're going to hold off on making any changes to Tower Direct. So it might be something we could do in the future when there's more clarity as to what the future with Tower is. But for the moment, we aren't going to make any change to Tower Direct. So if you're considering or if you've had a membership with Westwood Ambulance and you do get a letter or their annual membership drive in the mail, I would encourage you to continue with Westwood until the future when we do consider Tower in the future. But for the moment, we are not switching from Westwood to Tower Direct. In a recent update I provided over the intercom system, I pointed out how important it is when our housekeepers do come to your condo for condo cleanings that you do wear your mask. Wearing your mask when you're around anyone, a housekeeper, a family member, a neighbor, is very, very critical. It doesn't matter that your door's closed, and that's in your own home, if you're around somebody that you don't live with, it's so critical that you continue to wear your mask and socially distance. So we ask you that in order for us to be able to have our housekeepers clean your condo, if you remain in your condo, you do continue to wear your mask. Otherwise, the cleaner won't be able to clean your condo. And on that same vein, if you have a visitor, and we do still allow up to 2 visitors in your condo, that they wear a mask throughout their stay. That's very, very important. Just because you close your door, like I said, and it's a familiar face or a family member, they still do need to wear their mask. And we're at a real critical point with a high level of positivity with cases in our area. So please do wear your mask. Please have your visitors wear their mask when they're in your condo with you.
Hello everyone, it's Karen from John Bruner's office. I am here today to just talk about holiday decorating. First off, I'd like to thank everyone who participated in our holiday decorating in the atrium. I think it looks wonderful and very festive, and I hope everyone is enjoying it. I wanted to pass on to everyone in regards to our lighting outside. This coming Monday, we have hired a company that will be lighting the out front from the entranceway on Freedom Boulevard through campus and on the Village Green, along with our maintenance department, who will be lighting up the outside buildings on independent living, skilled, and personal care, the gardens, along with both terrace homes. So that starts on Monday and should be finished by Wednesday. So I'm looking forward to it, and I think you guys are all gonna love it. And once that's complete, we will be in touch with you to let you know when we're going to do a walkthrough of holiday lights, so everyone can enjoy the magical feelings and lights of Christmas. So I hope everyone is staying safe. And again, if you need anything, don't be afraid to reach out. And happy holidays. Take care. Bye-bye.
Hello, Freedom Village residents, and welcome to our town hall meeting. A couple things in maintenance I'd like to discuss. The asphalt repairs are almost complete. There is 2 areas that they have to come back to complete, and as soon as I get that schedule, I'll get that out to you on the Touchtown. And some of the projects coming up for 2021 that we're looking at are the window cleanings for the condos, the power washing of all the walls out exterior in our healthcare centers. We're also looking at some more asphalt repairs, as always. We're also looking for some more automatic doors. For example, the doors going into the Village Green from the Learning Center. We're looking to put auto doors and a few other doors that need some automation. We're also looking at replacing the gates in the parking garage on the lower deck. Those gates are outdated and out of code, and we'll be looking to hopefully replace those in the 2021 season. So we do have some other things on the books that we're planning, and I'll start to speak about it as our budget is approved as we move forward into 2021. And as all of you, I'm hoping for a much better 2021. I'm hoping for a vaccine that I can take. I'd like to be first in line if possible. And here's to saying goodbye to 2020 and hello to 2021. And thank you as always. This will be 1 full year, December 30th for me. And you've all been so welcoming to me, and I really appreciate it. So thank you, and hopefully you have a great Christmas and a Happy New Year.
Hi everyone, it's Sarah from Activities. I just wanted to pop in and talk a little bit about programming. As you know, we've added a few more restrictions to our community in the past few weeks. Some of that being the card room and the game room being closed for use. We also have just added a restriction for no groups larger than 20 people. This includes things like committee groups that are larger than 20 from meeting, as well as movies. Movies have been suspended and they will now be held on channel 1971 as we have done in the past. So you can watch those movies on the days that they were scheduled, at the times that they are scheduled on channel 1971. If we do have any issues with that, we will notify you beforehand. That way you aren't surprised by that. If you have any questions in regards to what is okay and what is not okay. And if you're just unsure of anything, please do not hesitate to reach out to myself or Martha. We'd be more than happy to answer any of those questions. And if we do not know the answer right away, we will definitely try to get that answer for you. Now, on to some of the things that we are going to continue, and hopefully they can spice up the holiday season since we're kind of in a dreary mood. We have our Elf on the Shelf that is continuing. If you find that elf, please let the front desk know, and you'll be entered to win a prize. He will be hidden somewhere in the atrium on the first floor every day. So as long as you find him and you turn him in, that day is yours. We're also going to have our gingerbread house decorating contest start this coming Monday on the 14th. If you signed up for that, you'll receive a call and we will have you come and pick up your supplies. We are also going to continue our door decorating contest. So if you have not signed up in book 2 yet, and you are planning on decorating your door, please go sign up because you will be entered to be a winner for that too as well, if everybody votes on your door. It's a lot of fun. We have not figured our door out yet. So if you walk by and see a bare door on the activities door, don't worry, we're gonna put something together. We're also going to be having our ugly sweater contest on December 21st, and that's going to be from 12 to 2. So you're going to come down to the atrium where we will be, and we will judge your sweater. And this will also be the day that the gingerbread houses get judged. We pull the winner for Elf on the Shelf. The door decorating contest winner is announced, as well as the ugly sweater contest winner announced. So it's going to be a really busy day, but it's going to be really exciting, and there's going to be lots of winners and lots of great prizes, so stay tuned for that. I just wanted to also talk about the outreach flower sale. This year they are going to continue with their annual outreach flower sale. The proceeds are going to benefit the Chester County Food Bank. I know a lot of people have been asking, what are we going to do for the community? How are we going to help? Are we going to have a can drive? This is what Outreach has decided to do, and we are so excited to be able to help them facilitate everything that they're doing here in the community. So if you would like to buy a beautiful arrangement, which they are very beautiful, the ladies worked really hard on them, please stop by the atrium between Thursday, December 17th and Saturday, December 20th at the times that they will be open. You can find these times in the Bugle and on channel 1970. They will be taking checks, and if you don't want a flower but you still want to donate, they are more than happy to take a donation instead of a purchase. If you have any questions about anything that's going on, if you have any concerns, if you have any input whatsoever that you would like to give us, or if you just want to stop by and say hi, please feel free to do so. We're so excited that we're still able to do some of the things that we're doing, and we're so happy when we get to see you all. We can't wait to be together again, and we hope you have a happy, happy holiday. Thank you.
Hello everybody, my name is Jeremy, Director of Dining Services, and we are really excited for our holiday party celebration that's coming up. It will look a little bit different, but we are still excited and it's still going to be a good time. So by now you should have received your invitation along with your menu for your selection for the holiday party. Please have your menu submitted no later than Friday the 11th. This way we can have everything ready to go and organized for the party. If you did not get an invitation, or if you lost it, or if you need another menu, whatever it is, please contact Martha and we can get those for you. But we are excited for that party on the 18th. Also, due to the times right now, the menu meeting and the dining services meeting have been canceled for this month, but there'll be other communication coming out with the need to knows of the menus and the theme. We will be sure to get that out on channel 1970 and on Touchdown as well.
Hi everyone, I'm Laura, I'm the wellness nurse. I just wanted to talk to you briefly about staying safe during COVID. COVID has been rising in Chester County, So we're taking more precautions, as you know. I just want to remind you to make sure you're washing and sanitizing your hands, wearing your mask, and keeping that 6-foot distance. Even when you're in condos, resident to resident socializing, make sure that you are still keeping the distance and your masks on. If you aren't feeling well, please reach out to me or your primary doctor. I can point you in the right direction, or your doctor can tell you what to do. Otherwise, stay safe and healthy, please.
Good day, everyone. Ross Small here, reporting for the village meeting for December. Wanted to do my usual bragging about our associates, so happy to talk about first our anniversaries for our associates for December. So we had a lot of great milestones this month. So some of the newer noteworthy ones I wanted to mention: Rick Tavani just hitting his first year on the 30th. Katie Hershey down at the front desk, her first anniversary is on the 20th this month. I'm excited for Katie for that. Lots of our servers hit 1-year anniversaries: Justin Rachevsky, Jocelyn Pusey, Edith Martinez-Ibarra, Sterling Zaplatny. So lots of great 1-year anniversaries amongst our team as well. Our maintenance team has 2 wonderful anniversaries this year. 2-year anniversaries for Brandon Lockett and for David Madonna, who do such a fantastic job for us. One of our nurses' aides, Joe McGonigal, one of our male CNAs, just does an awesome job, hit 4 years later this month. Lisa Zellner, she's our memory care manager. On the 15th, she's hitting her 4th-year anniversary with us. Let's see, a couple of our 6-year ones: Michael Powell, also from maintenance, and hit it on the 8th, so just a few days ago. And Katie Maxey is our Director of Clinical Services, hit 6 years on December 3rd, and we're just so fortunate to have her with us. Michael Bodner, one of our drivers, is Christmas Eve, the 24th. He's going to hit his 8th anniversary. And this month, I usually do a top 3, but I'm going to do a top 4 anniversaries. Hitting 14 years later this month on the 28th is Kelly Taylor, who takes such great care of us down in the Hunt Club. So privileged to have Kelly with us for the past 14 years. A 15-year anniversary, one of our caregivers down in assisted living, Barbara Ward, fantastic caregiver, hitting 15 on the 19th. One of our receptionists, June Kohler, hitting 16 years the other day on the 7th. Congratulations, June. And our highest December anniversary number is 17 years, with Gail Young from housekeeping hitting 17 years on the 29th, one of our housekeeping associates. So congratulations to all those anniversaries, and please express your congratulations for me as well, if you will. Since we didn't meet last month for Village Meeting, we did not get to announce our Employees of the Month for Extraordinary Impressions, so here they come. So we got 2 winners for November to announce and 2 for December, so 4 altogether. And I am going to read some of the notes from the Extraordinary Impressions cards that we got. And remember, you can find these in various locations throughout the community. If you're not sure where they are, just ask one of us and we'll be glad to point them out where they are near you. The November winner, first winner, is Dan Freeman. Dan Freeman from our housekeeping department. I'm going to read you some of the nominations. Always polite, always cheerful, always helpful. Dan is willing to go out of his way to help someone with the trash, the door, anything at all. And that's from Ann Osterholm. Next nomination for Dan: being friendly, helpful, obviously happy to be here and to be of service. Thanks, Phil Leifer, for that nomination for Dan. Dan's extraordinary impression is being himself. That is always greeting us warmly by name, asking about one's day, totally efficient with all his responsibilities, never slacks off. Being extraordinary is Dan's ordinary. And that's from Marilyn Herbert. Sorry. All right, congratulations, Dan. All right, my next winner for November is Nicole Worthington. She's one of our housekeeping team members down in the skilled nursing and the assisted living areas. She is never too busy to help. She is always very warm and friendly and just goes out of her way to help you. That's from resident Oni. Nicole Worthington, this nomination is from Jean Thomas. Jean says she has very high standards, is very thorough, she's always pleasant, does extra things for me without me asking her to do them. She is an A+ employee, and I agree. Congratulations, Nicole Worthington down in the Health Center. All right, we're also doing our December winners. So my first December winner is Noelle Butler. Many of you on the independent living side might remember Noelle from being over here in the dining department and taking care of us on this side before she transferred over and is now a medication assistant on the gardens. So this nomination comes from Fred Urbicella, and Fred says, Noelle was gathering my meds in a timely and precise manner, explaining what my meds were for and when to take them. I was going on vacation, and when I returned, Noelle had a very concerted interest in my camping trip that I did, since it was my very first time. We spoke briefly on enjoying the same camping experience. I also find Noelle very capable of doing her daily duties in a careful and wonderful way for us. So congratulations, Noelle Butler. And our final Extraordinary Impressions Employee of the Month for December is going to be Jennifer Fassbender. Jennifer, you might know, is in the Hunt Club, and this first nomination is from Walt Kopmeyer and Dick Aberley. Just a great server, a great person, a great cook, always greeting us warmly with a smile, always tries to anticipate our needs, always asks, is there anything else I can do for you, and all the wonderful things that the Extraordinary Impressions program is striving for. And then the next one is actually from one of our dining managers, Kim Heverly, for Jen Fassbender. One of the most pleasant and prompt employees at Freedom Village, and always taking care of us with a smile. I've been in the hospitality business for over 40 years, and there's no one like her. So Kim, thanks for that great nomination for Jen Fassbender. So as always, thank you all for letting me have some of your time to share some of the great things about our employees here at Freedom Village. Thank you very much.
Well, thank you for joining us at today's village meeting. I'm sorry we couldn't be in person, like I said at the beginning, but I hope you enjoyed the presentation, and I hope to see you again soon. Take care.